Well, good afternoon. Thanks once again for joining us for today's Daily Update. I'm Dougal Saunders, joined again today by the Chief Executive of the Western New South Wales Local Health District, Scott McLaughlin, and Assistant Commissioner Jeff McKechnie, Western Region Commander for the New South Wales Police Force. Up until 8 o'clock last night, we have 12 new cases of COVID-19 for the Health District. 5 of those are in the Bathurst local government area, 4 in Dubbo, 2 at Bourke, and 1 at Walgett. So the Health District total, the cumulative total, is now at 979, and for Dubbo, 707. For the Far West, 4 new cases reported for Broken Hill and 3 new cases for Wilcannia. Now, unfortunately, today we have to report the death of a 94-year-old Dubbo man. Scott will provide a bit more detail, but obviously at this time, our thoughts and condolences with family and friends during what is obviously a really difficult period. 434 people are currently being cared for in the COVID Care in the Community program at the moment. 40 extra people have been discharged in the past 24 hours, so no longer infectious and no longer requiring any care, which is good news. 450, it's over that 450 mark now for people that have been discharged from that program. Now, from the 12 new cases, we know that at least 6 have been infectious in the community, 3 of those for more than 2 days. That includes at Walgett and at Bathurst. 5 have been isolating, 1 still being investigated, and Scott will talk a bit more about the other linkages there. There's no sewage detection to talk of, but there is a bit more to discuss around some of these cases, and Scott will do that. I want to talk today about the importance of what Monday, September 13 today is, as far as our little ray of sunshine, which is coming into effect as of today. Now, I've referred to it that way for a couple of reasons. One is that we do actually have a bit of sunshine around at the moment. This is a way of looking forward to having some parts of normality that we haven't been able to enjoy for some time now back in our lives. It doesn't mean you can take advantage and do the wrong thing. So from today, if you are double vaccinated, you can be part of a group of 5 people gathering at an outdoor public area. So that does not include your front yard or your backyard. That's your home. That's not a public venue. You need to be at a public outdoor venue to be able to do this. What it does include, though, is a gathering with a few friends or family at a park. It might be a mother's group outing that you haven't been able to do. You and 4 other mums and your kids can now be at a park. You can have a coffee together. You can kick a ball around together. You do have to be double vaccinated, and you do have to be at a public outdoor venue. Under 12s do not count in that total. 16 and above, you do have to be double vaccinated, and that little group in between don't have to be double vaxxed, but you do count towards the number. So try and do the right thing. You still have to wear a mask. You still have to be doing all of the things that we're doing under stay-at-home orders, which means keeping some sort of physical distance, maintaining hand hygiene, maintaining a mask unless you're eating or drinking. Now, police won't be patrolling every single park, and Jeff will talk more about this, but there's an expectation on you to please do the right thing. This isn't the chance to take the mickey. This is the chance to actually enjoy some of those little special things that we've been missing. You do have to be double vaccinated. You can show that on your phone through the MyGov account. You can also get a printed certificate or a printout from the medical practitioner who actually gave you your first and second doses. So please look at that as a really nice opportunity. Don't look for a way to try and rort the rules, is the message today. Now, to clarify again, this has nothing to do with the target of 70% double vaccinations, which we're hoping to reach by mid-October. That's a whole separate scenario. This is just one of the small steps towards getting that. So we're, thankfully, pretty well on track to be 70% double dosed right across our region. For most parts, we're over 70% first dose, and we're certainly heading towards that in second doses, but there is a bit of a message around that as well, which Scott might talk a bit more about, as far as getting those second doses into people and making sure that appointments are actually being kept. So we'll talk a bit more about that. But do look at this as a small step forward, an opportunity, not all part of the same thing. Today, The scenario with 5 is different to the 70%, but all of it is about trying to get as many people as we can double vaccinated in as quick a time frame as possible. Some good news as well that was announced over the weekend for learner drivers. So if you are a learner driver, one of your supervisors can go with you, as in a family member, mum or dad, can go with you to practice learner driving. That's been approved over the weekend and signed off by the Health Minister. So it's not including learner driver businesses, but one member of your household can be the supervising driver. You can't take anyone else unless it's children under 12 that need supervision, but you can do some learner driving. In school news, Dubbo West Public School, it was closed as of Friday after a member of the school community there tested positive. That's been deep cleaned. All of the necessary tracing's been done. All of the people that had been identified as close contacts are now isolating, and that school again is open as of today for students that need to have that ability to drop kids off. So Dubbo West Public School back in action. Testing, just over 2,200 across the region. Scott will talk a bit more about the testing scenarios. I just wanted to quickly mention the heavy vehicle testing facility, which is now open as of this morning at Blackbutt Road Rest Area, just south of Dubbo on the Newell Highway. So that's running 6 a.m. till 9 p.m. fully staffed, and out of hours there will still be security there and a telehealth advisor to help you do a bit of self-testing there, but that means 24-hour availability for heavy vehicle drivers just near Dubbo now, which is fantastic news. And of course the mobile at-home testing service for people around the region, Dubbo, Bathurst, Orange, 1300 066 055 if you need some help. Now vaccinations have been going well. It was a massive weekend. To Orange and Bathurst, huge thumbs up, really well done. Over 2,000 jabs in arms on Saturday alone for that big Super Saturday. So really massive effort from all of the people involved, including all of the people actually giving the doses. So thank you for that. The Dubbo ADF clinic, I was here across the weekend. It's doing well. Second doses of Pfizer going into arms. But one thing just to remember is if you receive a text message giving you a day and a time, we really want you to turn up at that day and at that time. Now, the time frame's normally an hour. If you can't make it for some reason, please reply to that text message and ask for a different appointment time. There have been too many people not turning up for their appointments, and this is a massively concerning part of this. We really want you to be turning up. If you do have a reason, we want you to try and reschedule so we make sure we get that second dose. So please do that. Second doses start tomorrow at the ADF clinic at Parks. So similar scenarios here. Text message, turn up at the time, take your Medicare card, all of your ID and that sort of stuff as you have been. Second dose is starting there tomorrow. And Wellington, second dose has started today. Again, it's been a huge couple of weeks there at the combined clinic there. Over 2,000 Pfizer and AstraZeneca has been going since April there, another couple of thousand there. So well done to Wellington. Wax still doing AstraZeneca, as is Swift Street Medical, but second dose is starting as of today. Now, as far as booking your second vaccine, if you are not fitting into one of the vaccination clinics, that's okay. And particularly for younger, between 12 and 16, really encouraging you to book with a GP clinic or go to a pharmacist if it's somebody that you normally get your flu shot from. But GP clinics have huge availability, and I've spoken to several across the weekend. Most are open to clients that aren't normal clients at their practice. They've opened the books up. There is huge opportunity, so please contact any of the GP clinics in your particular part of the world and make sure you make a booking as quickly as you possibly can. I just want to quickly mention as well, this is Foster Care and Kinship Care Week. Really want to give a bit of a shout out to all the foster carers, all the kinship carers that do an amazing job in our community. It's been a really trying time for everyone. You're a really important part of our community fabric, so thank you for what you do. This week is a really important one to recognise the work you do. And the My Family Forever is doing a bit of a recruitment drive for more foster carers and kinship carers. So if you want any more detail, you're thinking about doing that, they'd love your help. Just do a quick search for My Family Forever, My Forever Family. Online, My Forever Family, and you can find out a bit more detail about how to get involved with that. I'm just going to finish with one of the questions that's come up this morning around stay-at-home orders. If I live in an area that is under stay-at-home orders and I work in an area that is not, what do I do? Look, in very simple terms, if you're living in a stay-at-home order and go to work somewhere else, you need to continue to follow those stay-at-home orders. So if you're travelling each day, when you're at work, you need to be acting as though you're at home and following those stay-at-home orders. That's the most simple way of putting it. You need to keep doing what you're doing under the stay-at-home orders when you're in an area that is out of stay-at-home orders, if you need to be there for work. If you can work from home, happy days. If you can't, you need to follow the stay-at-home orders as if you were at home. Hope that clarifies things a bit. I'll hand over to Scott now for his health update.
Thanks, Dougal. Well, an incredibly sad day to see the passing of a gentleman in Dubbo, so I can offer my sincere condolences to the family of this gentleman who was in his 90s, who passed away on Saturday at St Mary's Villa in Dubbo. Now, this gentleman had been vaccinated, but had significant other chronic underlying health issues, and so I offer my sincere condolences to the family, friends and community around this. Now, we know that this is an incredibly trying time for family and close people to aged care residents that aren't able to visit at the moment. I can only imagine how difficult it is not to be able to see a loved one in their last days, so my sincere condolences. Testing numbers, again, across the whole of the region have hit rock bottom. We're incredibly concerned about the very low testing numbers across a lot of communities, but in particular communities like Walgett, where we know we've got a current outbreak. I think 11 new cases in the current outbreak in Walgett, and multiple strains of transmission within that community. And so I'll come back and talk a bit more about testing more generally, but in a couple of these locations where we've got current outbreaks and real concern. The testing at Walgett will be available again today at the swimming pool between 9:30 and 4, and so can I encourage everyone, please, in Walgett, come out and get tested. A fantastic weekend with vaccination across the whole of the region, but in particular Orange and Bathurst with the Supervax Saturday that saw over 2,000 people on Saturday vaccinated. Now, across the whole of the week between Bathurst and Orange, over 8,000 people were vaccinated across the two regional cities. So thank you to everyone that come out to get their first jab in those communities. We've still got a lot of health services out on the ground vaccinating in those communities, the Aboriginal medical services, the GPs, the pharmacies and the respiratory clinics in those communities. So please don't ever hesitate to come out and look for a vaccination. In particular, this week we've got the Orange Aboriginal Medical Service in Bathurst in the Kelso community providing vaccinations. That's kicked off at midday today, right through until 4 p.m. every day, starting at 10 a.m. from here on. And so I can encourage everyone in Bathurst to come out and get vaccinated as a matter of urgency. As Dougal mentioned, in the last 24 hours to 8 p.m. yesterday, we saw 12 new cases across the whole of the local health district. Again, that's a lower number than what we've seen in recent weeks and days, but with lower, nearly record low testing numbers, there's, I'm sure, a connection there and a real risk of people circulating around our community that are infectious, that aren't getting tested and may not know that they have COVID. We've now seen another 40 people recovered or discharged from our care in the community program in the last 24 hours. Again, further positive signs that people are getting through their time with COVID and being discharged and returned into community. So to 8 p.m. yesterday, 5 new cases in Bathurst, and that's a real concern with a number of those infectious in the community. More cases in Bathurst than Dubbo in this 24-hour period. 4 cases in Dubbo, 2 in Burke and 1 in Walgett. That 1 in Walgett is of particular concern, and so again to the community, please come and get tested today as a matter of urgency. Now, 7 of the cases out of the total 12 are known to be linked. 3 of those are household contacts and 4 are linked to known cases or rather clusters. 5 are still under investigation of those. We know out of the 12, 6 or half of them were infectious in the community. And so again, a real warning that on any day of the week in any of our communities, we can have people infectious in our communities. We've still got 1 of those under investigation. Again, a bit of a change in the profile of our total cases, and I'll come back tomorrow to talk about our current cases in the care. But our total cases, we've now got 42 people over the age of 70. So again, a further growth in the number of elderly or aged people that are vulnerable and more susceptible to COVID having a significant impact on their health. To a couple of the issues or breakouts of concern. St Mary's Villa, we've now got 13 cases in total in St Mary's Villa in Dubbo, with 4 new ones in the last 24 hours. Again, a lot of care and support being provided to the residents and to the staff to try and halt the outbreak in this aged care facility. In the Holy Spirit Aged Care Facility in Dubbo, we've now got a total of 15 cases in total. There's been a lot of support come in with additional staff coming in from Sydney and other locations in the last 24 hours. Support from the local health district specialist teams, from GPs and others to try and help make sure all of the residents and staff in these facilities are well cared for. Lightning Ridge, we've had a sewage detection, and a new case identified since 8 p.m. yesterday. That is a new case that's still under investigation, but we do know that they've been in the community in recent days. So I'm going to urge everyone in Lightning Ridge and the surrounding communities, the mining communities and everyone that connects into Lightning Ridge to please come forward and get tested. We do have testing available up at the multi-purpose service, and we'll be looking at a further expansion of that in the next 24 hours. So please call ahead to the local multi-purpose service for testing. Again, a further growth in the venues of concern notified across the whole of the district, but particularly some new ones in Bathurst and in particular in Kelso, Dubbo, Orange and Walgett. So please, in those communities, have a look at the New South Wales Health website, look at the locations of concern, or the social media feeds from the local health district, local MPs and other community groups. Please keep your eye on those. They're changing on a daily basis. No new detections of sewerage in the last 24 hours, but a couple over the weekend of real concern in both Nyngan and Trangie, where we know there are no active cases at the moment that have been identified. And so can I ask everyone in those communities, any signs and symptoms, however mild, then please come forward and get tested. The mobile testing, as Dougal said, is continuing to be available in Dubbo, Orange and Bathurst. Please call ahead. If you can't leave your home for a range of reasons and you need someone to come in and help you get tested, those are available through the 1300 066 055 call centre. We've seen a further decrease in the number of patients in hospitals, quite a few discharged in recent days. So we've now got 16 patients in hospital, 3 in intensive care and 2 of those ventilated. So across the 15 patients, we've got 6 in Dubbo, 2 in Burke, 2 in Bathurst, 2 in Orange and 1 in Narromine. Now, all those patients are being cared for by our best expert teams and being well supported. I think there's a real success in being able to discharge patients out of hospital and return them to the home, which is clearly happening at the moment. Now, those patients being discharged are being discharged back into our care in the community program with hundreds of clinicians across the whole of our region going into homes every day of the week, supporting over 450 care in the community patients, and with 40 more discharged in the last 24 hours. We've now got 22 staff in isolation. Those staff are obviously in isolation either because they've been close contact of someone in the community or because of a workplace exposure event. These are the most precious staff that we all need to support and understand their role in caring for patients, not just in hospitals, in our community programs and outpatient clinics. And so can I ask everyone, just please think about your daily activities. When you're going out, please make sure you're wearing a mask. Make sure you're checking in to facilities with QR codes, social distancing, and use the hand hygiene available. Our staff are our most precious resource to make sure we can protect and support people with COVID and with other health issues across the whole of the region. We've yesterday seen, excitingly, 30 motorhomes delivered into Dubbo to be deployed on a minute's notice to any of our communities where we do need additional accommodation facilities to help either people with COVID or close contacts and family members be accommodated. We've already got 20 of those up in Burke and looking at further deployments to Engonia, Walgett and other communities in coming days when they're needed. And so there's some positive steps there. Listen, I'll hand over now to Jeff McKechnie. Thanks, Jeff.
Thank you, Scott, and good afternoon, everyone. A really good weekend, policing-wise, in terms of compliance across the region. Some of the lowest numbers we've seen in terms of compliance breaches. which is really pleasing. In fact, here in Dubbo in the last 24 hours, only 9 breaches were detected and legal action taken. So that's certainly a turnaround for us, and we just really want to see those low numbers continuing. Breaching the order, not wearing face masks are still prevalent. And as Dougal mentioned, as we move into this period, I guess, of a little bit more freedom around people being able to come together in public places in groups of 5, please remember you still must wear a mask out there when you are gathering. You still need to comply with all the things Scott just mentioned about hygiene, social distancing, being really careful. And of course, in that circumstance, you have to be double vaxxed. Police will be out with our ADF colleagues conducting compliance checks around the region, and we will be out patrolling as we normally do. So if you are out and about in a public place and taking advantage of that change with the 5 people, don't be surprised if you do get asked by police to produce evidence of your double vaccination. There's many ways you can do that, as we've heard. Please think about that before you go out and make sure you've got something, because if you haven't, there's a fair chance that you are going to receive a ticket for that offence if you can't produce evidence of being double vaccinated. So a little bit of pre-planning is required by everyone in that regard. We don't want to see people taking advantage of that, and we don't want to see people getting tickets and just creating unnecessary work. We've had, since this operation started, police and ADF staff in the region have conducted over 10,000 wellbeing checks. So we visited over 10,000 homes across the region, making sure people are okay, making sure they're complying with whatever their orders are, and making sure they've got whatever they need to keep that going and be safe and be looked after. So a huge amount of work going into this operation. When you hear Scott's numbers around the number of people we're taking care of in the community, the impact on resources right across Western New South Wales is massive. So we really do need to think about that in what we do, apply that to our decision making. If you're thinking about taking a risk, please don't. There's still a lot of COVID around out there in our communities. It's so easily transmissible, and the impact it can have is so significant. So please keep those things in mind. I'm happy to take any questions anyone has online this morning.
Thank you, Jeff. If you've got any questions, please raise your digital hand.
No?
Looks like there aren't any questions. Thank you.
Thank you.
Hamish.
Can do, thank you.
Yep, you got a bit funny, Hamish. Start again, mate.
Can you hear me now?
Yep. And no. Maybe move on, Kathy. We'll come back to Hamish.
We might have lost Hamish for a second. Robin, if you want to ask your question, please.
Yeah, I wanted to ask about how we can drive up testing. Is there anything the government's looking to do? I know that there's been a trial in Liverpool of surveillance testing where instead of isolating, you're able to still move, just be a little bit more careful. Is that something that might be considered for the Western region? Because, at the moment, a lot of essential workers, they go to test. They don't know how long they're going to be off work, so that's almost a deterrent. Yeah,
it's a good question, Robin, and thanks for that. There has been a fair bit of discussion around how we could look at moving to that sort of a model. It's something that Health is certainly looking at in fairly minute detail at the moment. The one concern that brings up is where there is a case or a cluster of cases that are known to be concerning, you do actually want people to isolate in that circumstance. So there are a couple of different ways of managing that, but certainly from an industry perspective, Council, Health and the government have all been working very closely together around making sure surveillance testing is available to industry groups to make sure that larger groups can keep working, and it's an important way of doing that. So I think hopefully in the next couple of days we will have a bit more worked out around exactly how that could work. So it is on the agenda, yes.
Thank you, Robin. Olivana, your question, please.
Good morning, or good afternoon, Dougal. I just had a question, also about testing numbers. Is there any kind of concern that if we don't get testing numbers up and if we do have, undetected cases of COVID still circulating in our communities, that could jeopardise the possibility of some communities coming out of lockdown early or having lockdown lifted?
Yeah, look, I think that's probably a realistic way of looking at it. The low numbers of testing can obviously equate in some way to the low numbers of active cases, if you like. So whilst it's really good and heartening to see case numbers come down, and today, as Scott pointed out, for the first time, Bathurst is actually above Dubbo in new cases overnight. That's the first time this has actually happened since the 11th of August. So, but with that, I mean, that has to be taken in, I guess, for what it's worth in seeing the testing numbers at the same time. So it's with optimistic hesitancy that one could say things are heading in the right direction. We do need testing to be increased, but hey, Scott and I have been here for 34 days in a row now saying we need people to get tested. There's not much more we can say. It's up to individuals to do the right thing. They're not going to do it just because we're saying it. We need community to be aware. If testing numbers aren't there and cases are low, then there is quite a good chance that there is a little undiscovered river of COVID flowing around somewhere. So it's concerning.
Appreciate it. Thank you.
Thanks.
Thanks, Olivana. Tom Barber from the Liberal.
Hi, Dougal. Phil Donato said this morning that after we reach 80% fully vaccination, he'd like to see stay-at-home orders and everything sort of, I guess, gone. Is that something that the state government would consider?
Well, there's already been the start of a roadmap released last week by the Deputy Premier, so I'm not sure why the member for Orange hasn't looked at that. But at 70%, that's the first target we have. That will hopefully be reached by mid-October. At 70%, there are things like 20 people at outdoor gatherings. There are 50 people allowed at weddings. There are people back at your home. There's domestic travel, importantly, including regional travel. So we can welcome people back to this region. Only double vaccinated people, but there is a bit more freedom there. Now, above 80%, and I think it's worth noting it does need to be above 80%, that we can look forward to further scenarios unravelling, and that might include things like international travel for those who are looking at that as an option, but it would also include probably more free movement between areas and different businesses of all kinds being able to operate in a bit more of a free manner, if you like. So there is a definite pathway. 70% is the first step in that. Over 80% is the next step in that.
Thanks, Tom. Tom and Olivana, if I could get you to put your hands down now that your questions have been answered, that'd be great. And it doesn't look like any other questions have come through unless, Hamish, you've rejoined us. Did you still have a question for Dougal?
Hi, Kathy. I'll try again. Do you have me now?
Yeah, talk fast, mate.
So essentially, I wanted to talk about
Hamish
has gone back to alien land.
We've lost you again, Hamish. You might need to either get Claudia to ask your question or maybe text something through real quick. But that's it for questions for you for now.
Thank you.
Dougal. So, guys, if you've got a question for Scott, if you could raise your digital hand, please, while Scott fights with his spectacles. Claudia from Prime.
Hey, thank you. I will ask Hamish's question for Dougal if I get a text through, but I'll just go with Scott for now. With the 8,000 people vaccinated at our local hubs in Orange and Bathurst, firstly, how incredible is that, and where do you sort of see us, or when do you sort of see us, predict to see us come out to 70% double dose?
Alison, it's just amazing to see so many people vaccinated over the last week in both Bathurst and Orange. So thank you to everyone that's come out to to get vaccinated. We know that that's going to continue, that there's a lot of opportunities for vaccination in both cities and communities surrounding that, with ADF clinics I know today in Lithgow, but the GPs, pharmacies, Aboriginal medical services and our vaccination hubs continue in both Bathurst and Origin. So if we can encourage everyone to continue to look for opportunities. Now, we know that the rate of first doses across Western New South Wales is now about 78%, so getting close to 80% of first doses. Later on today, we'll see an update to those figures, and so I'll be happy to provide those in coming days. I'd expect that, as Dougal said, around mid-October, we'll get to around that 70% double-dosed level. Now, that relies on everyone looking for opportunities for your second dose. Now, as Dougal's been saying, if you've had your first dose through the ADF clinics, you will receive a SMS message. Please book in or turn up for those appointments. We've had quite a significant number of people in the last 24, 48 hours that haven't shown up for their second dose appointments. We're really worried about their health, but also want to make sure that we can get vaccines into the arms of as many people as possible. And so please look out for those opportunities.
Thank you so much. And now just quickly in regards to the 22 health staff in isolation, can you give us any light into how the system has been impacted and whether there's a shortage or whether additional staff have had to be brought in?
Sure. So it's been helpful to see a lot of the staff returning out of isolation in the last couple of weeks. We started off with, I think, around 180 staff in total in isolation, and so that was really challenging for those staff as well not to be able to come and care for patients. We have found additional staff in the last couple of weeks, staff that have come in from Sydney to go out to Burke and other locations, staff that have put their hand up to come and work for the local health district. So that's been incredibly helpful. There is a recruitment campaign national around the whole of the country to try and identify additional staff that we know we'll need in coming weeks if the rate of cases continues to increase across the whole of the region. So I guess that's the real warning for all of us, that our health services are precious resources. If we see continual increase in numbers of COVID cases, we know health services will be pushed. We do have the ability at the moment to care for all of the patients with COVID and with general health issues, but please, everyone, keep in mind that our health services are precious resources to help protect and support.
Thank you so much. That's me.
Thanks, Claudia. If you could pop your hands down when you've asked and answered your questions, because I'm an old lady and I get confused very easily. Thank you. Maggie from Parks Phoenix.
Thank you. I'm just wondering, with Parks getting quite close to 2 weeks now without a new infection, do you have the rates yet of how many active cases are still in Parks? Is that available?
Maggie, I'm planning to come back with that tomorrow. We're just doing some recalculating of when cases were identified, the period of their isolation, and making sure that we can be accurate with that. So I'll come back with that tomorrow.
Okay, great. Thanks. That's all from me.
Thank you, Maggie. Alana from the Central Western Daily and Orange.
Thanks. Hi, Scott. Just to kind of drill down some of those numbers that were mentioned earlier. So 8,000 people were vaccinated last week across Bathurst and Orange. Do you know the numbers for Orange specifically?
Yes, I do. So out of those numbers, there was 4,200 for Orange and 4,100 for Bathurst. So it was a pretty close horse race between the two cities. Orange just pipped in front.
Great. And you said last week that you thought Orange is going to rocket past 80% for first doses. Do you have an idea what percentage-wise Orange is for first doses now?
I'll come back with some of those data tomorrow for you. We're expecting to see the end of last week data come through later on this afternoon. So I know that with the vaccination last week and right throughout all the primary care providers, it's been really significant. So I'd expect we're going to be well over the 80% for first dose and creeping up over 50% for second dose.
Great, thanks. And just lastly, about Donato saying this morning that he was obviously calling for the region, just us, our region, to open up once we hit 80%, even though the rest of the state hasn't reached that percentage yet. How is that something that you can see us doing, or?
Well, I think one of the most crucial things across Western New South Wales is to make sure that we can get vaccination into the arms of everyone that's vulnerable or at risk of COVID. We know that people over the age of 50 really struggle if they pick up COVID, and they can decline really rapidly. We're seeing an increasing number of people over the age of 70 who are double vaccinated, but still got around 15%, I believe, who haven't had either one or two vaccinations. And so for me, the concern isn't so much about the 70 or 80%, it's about who's been vaccinated, and are we vaccinating the right people in our community to help support them and keep them safe. So can I encourage everyone, think about your mum and dad, your aunties, uncles and family friends that may have ongoing chronic health issues, might have other issues that have limited them being able to get to a vaccination, whether they're homeless, whether they're not able to get out of the house because they haven't got a vehicle, or they've got a disability, or for other reasons. If they haven't been vaccinated, then please help them think about how that can happen. There's a lot of vaccination opportunities across all of our communities through the GPs, pharmacies, Aboriginal Medical Services, our own hubs and the ADF clinics that will be returning to town. So please don't hesitate looking for opportunities for vaccination, and particularly for some of our most vulnerable people in our community.
Great, thank you.
Thanks, Alana. Joe Woodburn from ABC.
Thank you. Mr McLaughlin, New South Wales Health, in its release today, said that eight of the Western region's 12 cases are in correctional centres or in correctional settings. Can you provide more details about that? So, yeah, 8 of the 12 are from correctional. Would that be 5 in Bathurst Correctional Centre? Where would the others be? Would they be at Wellington?
So I'm not sure about that number, Joanna. We'll have to do some double checking, but out of the 12 new cases, there was 5 in Bathurst. 2 of those were in isolation and definitely not infectious in the community. 3 were infectious in the community. The 2 in Burke were in isolation and household contacts. The 4 in Dubbo, 1 of those was in isolation and a household contact. 2 were infectious in the community, 1 still under investigation. And the 1 person in Walgett we know was infectious in the community there. There's definitely not 8 out of that 12 that were connected to correction centres.
Okay, no worries. My second question is sort of on the opening up of in some areas. So some of the LGAs within the LHD now are out of lockdown over the weekend. Do you support that staggered approach to open up certain LGAs within the broader Western Local Health District, or would you prefer that we all come out at the same time because of the risk of transmission?
Well, I think the important thing at the moment is we know on any day of the week COVID can be creeping around any of our communities, any of our homes, our supermarkets, our service stations. And so can I please urge everyone, whether you're in a location of concern or an area of stay-at-home orders or not, your behaviour shouldn't be any different when you're out of the house. Please do all of the things that protect yourself and the community. We know that with the sewage detections going off in Nyngan and Trangie, potentially cases travelling through other communities. This could be your community any day of the week. And so for me, I'll just ask everyone to be a bit pragmatic about this. Don't leave the house if you don't need to. We know that COVID is circulating around our region. We know that there's undiagnosed cases circulating in our region that we haven't picked up with the low testing numbers. So whether you're in an area of stay-at-home orders or not, please just be pragmatic. Think about your behaviour when you're outside of the house. If you don't need to leave the house, then please don't do it.
Thanks, Joe. And the last hand in the air that we've got at the moment is Robin at ABC in Dubbo.
Hi. With 2 aged care facilities now being affected in Dubbo, almost 30 cases at those 2 facilities, what sort of resources are you putting into aged care and those places in particular to help with those outbreaks?
Yeah, sure. So late yesterday evening, we're in a lot of discussions with Catholic Healthcare, who operate both of the aged care facilities. There's half a dozen staff turning up today, specialist staff that have worked in aged care facilities with outbreaks previously. We've got some of our specialist hospital in the home and care in the community clinicians that are coming in to care for residents, GPs that are coming in to care for residents. I know there's been additional PPE, additional support staff that have been found for those aged care facilities. There's a lot of changes going on in those aged care facilities to try and help keep the residents safe in particular. That might see some moving of residents into areas where we can care for those residents safely. And so there's a lot of things that have been learned over the last 12 and 18 months of what to do in an aged care facility outbreak. It's definitely concerning. We don't want to see another tragic outcome like we have in the last 24, 48 hours. And so everything's being done to try and avoid that.
My other question relates to follow-up doses. If you're not getting people coming for their follow-up doses at Pfizer clinics, the pop-up clinic in Dubbo, how does that concern you to us being able to reach regional double vax targets?
We want to see people getting their second vaccination however they can get it. Really happy if that's through the local health district or ADF pop-up clinics. People will be getting a text message to notify them of the time to come for those clinics. You can respond to that text message if you're not able to make it, or you need to provide some information back to our staff that are coordinating that. And so please, if you can't make your appointment, then respond to that and let us know. We will fill that appointment with someone else, and that's the most crucial thing at the moment, is getting people vaccinated right across the whole of the region. If you have been vaccinated at those hubs or anywhere else, please look for your local most available vaccination point. It could be through your GP, your pharmacy, Aboriginal Medical Service, our vaccination hubs or the ADF clinics. Don't hesitate to look for those second dose appointments. The particularly important part is the time frame around those. So 3 weeks if you've had a Pfizer jab, or 4 to 6 weeks if you've had AstraZeneca. Now, that'll continue to right through the coming months. Please book in for your second appointments if you've had those at a GP, an Aboriginal Medical Service or pharmacy, and make sure you follow up on those.
Thanks, Robin. And I think we've got one last question from Olivana.
Yeah, apologies. I just wanted to quickly ask whether you know off the top of your head 12 cases today. Is that the lowest we've had in over a month?
It is a lower number than we've seen for quite some time now. It's a little bit heartening, but I don't take any real confidence that we've licked this by any means. So for me, the low testing numbers and low case numbers, I think, are connected. Please, if anyone's got any signs and symptoms, however mild, then please come forward and get tested. Do that if you're leaving the home and you've got any symptoms. Don't go anywhere else. Come and get tested immediately. Those are the most crucial things we can do.
Thank you.
Thanks, Olivana. That looks like it for this afternoon. Thank you, everybody. Sorry for any technical problems that there were today, and we'll have the recording to you as soon as possible this afternoon. Thanks, everyone.
Thanks, everyone.
Thank you, Scott.